So your skin itself, we said it's your integumentary system. So this is your first system. Are you ready? So your system consists of two major layers, the epidermis and the dermis. So the epidermis is stratified squamous. We showed you that in tissues and cells. And stratified squamous epithelials. And it actually forms the surface layer. So when you scratch yourself but you don't bleed, this is the layer you are scratching, your epidermis. The dermis is a deeper tissue layer. So this is the deep skin layer. So it's under the epidermis if you're moving from the outside to the inside. And this is going to be full of nervous tissue, blood, connective. So when you cut yourself and it bleeds, you've cut into the dermal layer. You've cut into the layer that has the blood vessels, the cardiovasculars, and so on. We also look in the dermis as having the roots for our hairs, oil glands, sweat glands, muscle, all kinds of things going on in this dermal layer. And when you really cut yourself, and you cut yourself so badly that you notice it doesn't even really hurt, you've severed the nerves to that location, so you have actually cut through the dermal layer and typically down to bone at that point. Don't do that. So here you are, this epidermal layer on the outside. So if you scratch this surface, it's not going to bleed on you. It may hurt. If you scratched yourself enough, it will hurt. There are what we call free nerve endings here that are going to pick up that pain sensation and send it to your brain. The dermal layer, though, is where we get into all the blood and sweat and nerves and oils and hairs and fat and everything coming together. So your skin is actually quite thick when we actually look at it like this. So the epidermis there really is for protection and gives some layer of protection against injury and damage to the dermal layer. This decreases water loss, so this is the layer that's going to kind of waterproof you, and it's going to protect you from microbes as well. So there are a whole lot of good bacteria that live on your epidermis and help protect you from the bad bacteria in the outside world. The dermis is going to collect sensory information. So are you sitting? Are you pinching your skin? Is something hot? Is something cold? This is all being processed through the dermals of your skin. We look at vitamin D synthesis occurring in the dermis. And we also look at body temperature regulation. So it's going to sense when you're too hot or too cold, stimulate sweating to help cool you down, stimulate the papillae in your skin that would actually cause your hair to stand on end. When you're cold, you know how your skin gets goosebumps, right? And your hair stands up. The idea is you've decreased the surface area of your skin to help hold in heat. The hair of your skin is actually very, very important to help with insulation and some sensory. So you can tell if you're touching a little tiny hair on your arm, right? Do it. Find a little tiny hair sticking up on your arm and touch just the end of it. You can feel that all the way up your arm. It kind of tickles sometimes, right? Okay. Oil glands are very, very important for helping to inhibit bacteria growth and to make sure that your skin is in good condition. We know in the winter time when our skin gets very, very dry that the oils are not being produced properly and our skin can get damaged from that.